Hi everyone, my name is Paulina Escares Garcia Olvera and I am a medical student of the Anáhuac University Campus Querétaro. From everything learned in the bioethics course, in this video we will talk about how to give bad news to our patients, unfortunately. Communicating bad news to our patients is one of the most important things we do as a family physicians. The attitude, communication skills, and empathy of the person delivering the bad news plays an important role in the coping environment abilities of patients and their families. We are in a unique position to ensure that the bad news conversation is not a one-time event, but rather the beginning of an extended journey for the patient and physician. Traditional medical training has emphasized curing and helping patients, which may make recruited to discuss a diagnosis or other information that will make the patient's life worse. Some physicians may feel that they have failed the patient if a cure is not possible. Sometimes these feelings result with withdrawing from the patient or offering false hope in a dire situation. We will comment on 3 reasons why healthcare professionals fail to communicate bad news to terminal ill patients. The first one is the discomfort and stress they are feeling in doing so. It is to know whether this discomfort arises from anxiety over the impending death or negative attitudes toward the ending of a life. The second one is concern about the negative impact on the patients. Doctor believes that patients do not wish to know their real diagnosis and prognosis. The final reason professionals choose not to communicate bad news is sensitivity to the wishes of the family or the patient. Effective communication is important to provide accurate information and prevent misunderstandings and realistic expectations, particularly when giving patients bad news. Miller, 2002, described effective communication as a cyclical and interactive process between communicators consisting of messages being sent, received, and responded to, with feedback being given to the originator to the message. Communication failure can arise from a breakdown at any point in the circle. To understand individual needs and the uniqueness of each patient, doctors need to understand their own needs, personalities, qualities, and weaknesses. Becoming more self-aware enables nurses to observe how they react to particular situations, what effect they can have on a situation or another's. It is through experience that an individual accumulates knowledge about how to communicate. Communicating bad news is a fundamental physician skill. Physicians should be aware that their own sense of what constitutes a good encounter may differ from that of many patients, especially when cultural backgrounds differ. These conversations, when handled well, can help patients feel informed and hopeful, and physicians feel affirmed in their commitment to care for patients. Thank you.